The perennial shrub butterbur is known to inhibit plasmahistamine, leukotrienes, and the priming of the mast cells in response to allergens. Traditional Chinese medicine has used butterbur to treat asthma, migraine, stress, and gastric ulcers. A pharmaceutical compound is extracted from the plant, and it's been commercialized and approved in Switzerland as an anti-allergic drug to treat seasonal allergic rhinitis. A randomized control trial found it to be effective for improving asthma scores when compared to placebo, and another study found it as effective as antihistamine drugs. A systematic review of 6 randomized control trials found the butterbur extract is effective as a non-sedative antihistamine for intermittent allergic rhinitis, and it also reduced airway inflammation in the lungs of asthmatic animals and inhibited the production of Th2 cytokines. Extracts from the Japanese butterbur, which contain a profile of active compounds similar to the regular butterbur, inhibited the eosinophil infiltration, and it reduced mucus secretion in an animal model of asthma. In cell culture studies, the extract inhibited the release of interleukins triggered by house dust mites, suggesting the butterbur can suppress the pathogenesis of airway inflammation. Quercetin is one of the most common flavonoids found in a variety of foods like red wine, green tea, and apples, and it's been studied for its ability to reduce the symptoms of allergies. It's been known to inhibit leukotrienes, mast cells, and the release of histamine, and this makes it a good candidate for anti-allergy therapy. Evidence also demonstrates that quercetin blunts the inflammatory response in the immune cells upon antigen recognition. In an animal model of peanut allergy, the quercetin completely stopped the peanut-induced anaphylactic reaction. Histamine levels in quercetin-treated rats were significantly lower than the positive control group. In guinea pigs who were sensitized to ova-albumin, a relatively low dose of quercetin reduced the hyperactivity of the airways, and it caused significant bronchodilation. Quercetin microemulsion treatment exhibited anti-inflammatory properties in a similar designed murine model. Patients with nasal allergies who were treated with nasal spray that contained quercetin and artemisia experienced rapid and significant release from nasal symptoms that was comparable to antihistamine preparations. In 2 independent randomized control studies among patients with pollen allergies, 100 milligrams of quercetin-related compounds for 8 weeks significantly reduced the nasal symptoms compared to the placebo group. Chemically similar to quercetin, the flavonoid hesperidin has been studied in a variety of contexts in both experimental models and in human clinical trials. Its chalcone form was specifically studied in 99 atopic individuals. A daily dose ranging from 100 to 600 milligrams of hesperidin methyl chalcone provided complete relief of allergic symptoms in 35% of the study participants. Another 34% of the subjects achieved partial relief. More recently, the hesperidin methyl chalcone has emerged as an effective treatment for chronic venous disorders. Today, innovative doctors frequently suggest hesperidin methyl chalcone to patients with allergic symptoms, and they report clinical effectiveness. Rosmarinic acid is a flavonoid, and it's found in various herbs like basil, sage, mint, and rosemary. It's reported to have antioxidant, anti-inflammatory, antimicrobial, and anti-tumor effects. Rosmarinic acid can also inhibit pro-inflammatory cytokines and chemokines, and it can stabilize mast cells. In animal models, cell cultures, and human studies, rosmarinic acid has shown potential as a natural therapeutic agent for asthma and allergic diseases. Researchers have demonstrated a daily treatment with rosmarinic acid given orally to mice prevented allergic asthma caused by dust mite allergens. The investigators concluded the oral administration can treat allergic asthma symptoms effectively by attenuating the production of cytokines and allergy-specific antibodies. In another study, volatile rosemary extract significantly suppressed cytokines, eosinophils and neutrophils in mice models of allergic asthma that were induced by house mites. Similarly, The rosmarinic acid effectively suppressed cytokines, chemokines, and immunoglobulin E levels in murine models of atopic dermatitis. It was also able to alleviate the symptoms related to allergic rhinitis and allergic rhinoconjunctivitis in allergen-sensitized animal models. Oral supplementation with rosmarinic acid in patients with allergic rhinoconjunctivitis significantly relieved the symptoms and inhibited the eosinophils in nasal lavage fluid. Another study demonstrated that perilla leaf extract enriched with rosmarinic acid is effective among humans suffering from seasonal allergic symptoms. In this study, the rosmarinic acid inhibited the eye-related symptoms associated with seasonal allergies. In a randomized study on atopic dermatitis, the patients given topical rosmarinic emulsions applied to the elbows twice a day for 8 weeks reported improvements in skin dryness and redness and general symptomatic relief. The leaves, flowers, seeds and root of the common nettle contain different chemicals such as histamine, formic acid, acetic acid and other irritants that can mildly, painfully sting, cause itchiness or numbness with contact. Historically, the stinging nettle has been used to treat allergic rhinitis, but very few clinical studies have been conducted. In an open trial on 69 patients with allergic rhinitis, 58 of the subjects who took 600 milligrams of freeze-dried nettle leaf reported a relief in the symptoms of rhinoconjunctivitis, and 48% found it more effective than over-the-counter medications. The long-term use of stinging nettle extract was shown to have anti-inflammatory effects and to be effective in preventing chronic colitis in animal models. Data from bioassay experiments revealed the bioactive constituents in the nettle can inhibit the histamine receptor, inhibit enzymes involved in releasing cytokines and chemokines that cause allergy symptoms, and reduce the production of allergy-specific prostaglandins. For the first time, these results provide a mechanistic understanding of the role of nettle extracts in reducing allergy and other inflammatory responses. The term spirulina refers to the dried biomass of a species of cyanobacterium. It's widely consumed by humans as a dietary supplement, and it's even used as a food source for some aquatic species and poultry. Spirulina is a source of a variety of micronutrients and phytonutrients. It's also, by weight, a good source of non-animal protein. Studies have shown spirulina exerts a number of favourable biological effects in both humans and animals when it's consumed as a food or a supplement. Additionally, the United States Pharmacopoeia Convention recently assigned a safety rating of Class A to spirulina, meaning that data supports a high level of confidence regarding the safety of spirulina when used as a dietary supplement. Several trials have examined the role of spirulina for modulating the biology of allergic response. When administered at 2000 milligrams per day, the spirulina was shown to shift the T-cell profile away from the Th2 in allergic rhinitis patients by inhibiting the interleukin-4 signaling. Upon analysing the results, the scientists state that the human feeding study demonstrates the protective effect of spirulina towards allergic rhinitis. In a similarly designed clinical trial, it was shown that spirulina consumption significantly improved the symptoms and the physical findings in allergic rhinitis patients when compared to a placebo, including nasal discharge, sneezing, nasal congestion, and itching. To better explore the mechanisms by which the spirulina blunts allergic reactions, it was found that spirulina lowered immunoglobulin E levels and correspondingly attenuated the degranulation of the nasal mast cells, resulting in suppressed histamine levels in the blood. Dehydroepiandrosterone, or DHEA, and its metabolites are naturally present in humans, and they exert an array of actions through human physiology. Through numerous studies, it was found to possess considerable immunomodulatory action. DHEA has been shown to promote a balance between the Th1 and Th2 cytokines and to combat inflammatory responses. It's been measured for its impact on allergic reactions in clinical trials. In one trial, immune cells were taken from subjects with asthma, and they were cultured with or without DHEA. When the DHEA was included, the immune cells produced less inflammatory cytokines and other allergic mediators, leading the investigators to conclude the DHEA might be a useful therapy for asthma. Another group showed nebulized or inhaled DHEA sulfate improved the symptoms in patients with asthma. Several lines of evidence support an anti-inflammatory role of DHEA in atopic individuals, but the levels of DHEA decline with advancing age. The supplementing with DHEA can restore the blood levels, but one should always work with a doctor to first assess their blood levels before supplementing with DHEA or any hormone or hormone precursor. For more on allergies, herbs, supplements, or natural treatment plans, check out my website.